the facility. But so we did, it was a lot of extremity wounds. And we did that for about 5 days, and then we actually went into Port-au-Prince for the last 2 days and did surgery in the General Hospital in Port-au-Prince.
The reports are there were a lot of amputations that were necessary and the wounds that became infected that weren't properly treated to begin with. And then
absolutely. And that's where actually...
limbs that could have been saved, but...
That could have been saved, yeah. The two primary specialties that I probably needed the most was orthopedics and plastic surgery. Because these are large, open wounds that went untreated, and so most of my surgeries were 15 minutes long, and it involved one instrument, a surgical scalpel, and it just removing dead tissue and infected tissue to make the wounds into a clean wound so that you could start the reconstructive process. But when I got there, these were dirty, neglected wounds that had to be cleaned with very simple means, but they just didn't have the facilities.
Had you ever seen something like that before?
No, it was my first time. I've done third world medicine before, but it was, you know, not in a acute trauma type disaster situation.
Right.
So this was my first time in that type of situation, and it was very, very different and eye-opening.
Was it pretty shocking when you got there to see what had happened? Because you can watch the images and hear the story on television.
Right, it's very different than being on the ground. Yeah, absolutely, it was shocking. I mean, it was it's a devastated country. I mean, Port-au-Prince was flattened. I mean, there was very few buildings that were left standing. Every part of that community, and when we left 2 hours north, it was untouched. So really, it was just mostly in Port-au-Prince, where I was. If you didn't see the patients who were injured in this hospital, you wouldn't know that an earthquake happened in Haiti, where I was just 2 hours north.
It's amazing. Now tell us about the people. What was their reaction, and kind of how did they seem to you, given this tragedy, you know, that they had experienced and endured?
They are resilient people. I mean, unfortunately, the people in Haiti are used to tragedy, and so I don't know if they're just used to coping with it, but they actually they were dealing with it very, very well.
What about the kids?
The kids also were actually dealing with it. You know, it's awful to see a child with an amputated limb. And a child who's suffering, but the kids actually were dealing with it just fine. The parents were dealing with it fine, and so were the kids. There was very few people that I saw that were very, you know, depressed or unhappy. I mean, there are a few, of course, but the majority of the people were actually ready to get on with their life.
What do you think about that, Dr. Archer?
Well, I think he hit the nail on the head. I think that with Haiti in particular, they've been through so much over the last several hundred years, from earthquakes to not having a democratic government to the poverty and all of the things they go through. But it's interesting, even though I haven't been to the country, I have worked with some Haitians after the fact. They just seem to have a very positive mental outlook. No matter all of this that they've been through, and really they're just an incredibly resilient people.
Is that learned behavior because of what they've been through? Like, how do you,
I'll say that one of the things when we talked about
compartmentalizing. I mean,
well, when we talked about real quick, and then you can go. When we talked about the survivor mindset versus the victim mindset, I mean, when I did work with the Hurricane Katrina victims, for example, versus the survivors, and when I say victim survivor, I mean psychological. You couldn't predict ahead of time who was going to be a victim and who would be a survivor. You would have people that you would think, oh, they've lost everything, of course they're going to be down, or other people, oh, they have insurance and they didn't lose that much. But it didn't matter about socioeconomic status, didn't matter about who you lost. It was the individual's mindset going into it that determined, yeah, this is bad, but I'm looking forward and I'm going to go forward from here. And there have been a lot of studies looking at that, and it's very interesting, a mindset of the individual going into it and how they end up coming out of it.
But I also think here that it is the structure of the culture. It's the structure of people who live on an island, people who have had to be united in the face of disaster for many, many years. So the culture of the community has always been to help each other. And that's exactly what happened that was remarkable during the earthquake, is because people joined together to help each other as a community instinctively. It wasn't something that was taught, it wasn't something that was learned, it's part of the culture of their lives. And it has to do with the fact that they haven't had very much, so they've had to share. And I just wondered, is there going to be any follow-up?
With the group that I actually went, they were committed to 9 months. In
That's
Haiti.
great.
With this group, it's a new program at Duke, so they're going to be there for at least 9 months, and I'm sure they'll be there long after that. But there's a lot, you know, NGOs that are there even before the earthquake. They obviously need a lot of help, and they're going to need a lot more in years to come because it's going to take a while before that country's back to where it was even before the earthquake.
These are your friends, from medical school, you said? That
this was actually my roommate in medical school, who's an emergency medicine doctor at Duke University Medical Center, and he's actually in the Army Reserve, and he spearheads this new program at Duke for expeditionary type medicine to go into disaster areas in third world countries to set up shop. And so this was their inaugural event.
Wow.
That's
so you're obviously in close contact with him to hear about
it. Oh, yeah, sure. Yeah, he's actually been back and forth many times since we've returned, since he's the program director.
Is there any way that other professionals can volunteer to join this organization that your friend has set up?
There's many organizations you can join. There's the whole gamut of NGOs, Doctors Without Borders, Partners in Health. There's a lot of different type of organizations. There, you can also, if you're a physician, you can call your society. My society is the American Society of Plastic Surgeons, or the American College of Surgeons. All of these societies.
And they can make recommendations.
Yeah, they all have tight links with not only Haiti, but a lot of other countries that need help.
I think it's really important that as a professional, and I'm talking for myself as well, that we give to the rest of the world, and that we're there for disasters and to do things just the way you are doing.
Right.
Because you have expanded the notion of plastic surgery. And I commend you for that.
Well, yeah, unfortunately what you see on TV is just the cosmetic end of things, liposuction and breast augmentation, but there's a lot of plastic surgery that you don't see on TV that is reconstructive in nature.
And I think the average person probably doesn't realize that. They hear plastic surgery and they immediately think,
Dr. 90210.
Yeah.
Right.
Or the housewives or something, right?
They even had that on there the other night. I was flipping through and they had one of the housewives was going in. She's like, oh, I've got it. I'm thinking, what are you going to get that? Like, what could possibly be so wrong? She goes, I've got my gym clothes on. I'm going to put this, and I actually know her. It's Sonia Morgan.
Oh, you know her?
I know her, yeah. And I'm thinking, what are you doing? And she goes into this guy's office, and she's like, okay, well, here it is. And I'm thinking, right?
What
and she
is it?
lifts up her shirt, I swear. And like, and
like
she's grabbing it like this. She's like, right here. I need to. I'm like, wow. Wow. He's like, this will be very easy.
We need to have her volunteer.
We have,
she goes, I need the before and after
we have
picture.
Nip Tuck to thank for that.
Yeah, it was so funny. And he's showing her the picture. She goes, I need to see a before and after picture of somebody like me, you know what I mean, or whatever. Like, so she goes in and they show her like, yeah, like before and after. It's like maybe a little. He goes, we do like, what did he say? Like a pooch, like little pooch. We take care of the little pooch, or then we take care of the big ones. And then he said, it's amazing. Your body, will just go back in. The skin is very elastic, so it'll just go back. Anyway, so.
That is truly from the sublime to the ridiculous.
That's what you see on TV, because that's what sells. But what you need to see is more reconstructive surgery on TV, because those are great stories.
We did a big special on this program with Operation Smile.
Yes.
Which was
I was
remember,
on for that show.
That,
yeah, that was
I have
fantastic.
That at Operation Smile tonight. I was on the phone with them earlier because they want me to be a Smile ambassador. And I love that. I mean, there's other places and other groups that do that as well with the cleft palate, and what you can just change and transform a child's life. And I think it's so important. It's incredible. Incredible.
I had a patient whose son was born with a cleft palate. And there were multiple operations, and now he is a 15-year-old, absolutely beautiful, handsome young teenager.
Great.
And it was amazing. And the power, it made me appreciate so much what you do, other than the cosmetic stuff.
Right.
But to see how you transformed his life, because he had to have his nose, his lips, his speech. It was a very complete package with multiple procedures. And he wouldn't be the same without your services.
So that should be a reality TV show,
yes,
Kimberly.
That
Why don't
should
you make that and forget about all the other shows that we see on TV? Why don't you talk to the powers that be at Fox?
A life change.
You have so much power, you can get it done.
I'll just do it.
Yeah, right.
No problem.
Just tell them that that's what we're going to do.
Actually, that's a reality TV show that a lot of people would watch.
I think so.
I think it really would be very interesting. Because you see the process of transformation. It would be, what is it, like Home Improvement or something? People improvement.
Body improvement.
Yeah, I know. Well, let's talk about your practice as well. So we were speaking in the beginning of the program. You have, are you still in a practice in New Jersey or now just New York?
I'm in practice in New York.
Now?
Yeah, I'm in private practice in New York by myself. I do the full range of the specialty.
737 Park Avenue.
Right. Right, 737 Park Avenue.
Across the 71st.
He's going to have stalkers waiting outside of his office now.
I don't mean stalkers, people with needs that want to get sometimes you can go.
They'll be waiting when you leave the show and head back.
He gave me his card when I met him, and it has it on there. And I also know, well, but anyway, so, okay, tell us what you do in your practice, because you also, I want you to also touch on the specialty that you have with reconstructive surgery, body contouring for people who've had like gastric bypass procedures.
Right, yeah, so I do a lot of body type surgery in a reconstructive capacity with people who actually lose a lot of weight. It's head to toe type surgery in a staged approach. You lose 150 pounds, you have hanging skin, you need a plastic surgeon to help you to bring you back into a functioning capacity. All these people can't walk well, they don't have jobs because it's very hard to, when you have a belly full of skin, to function on a daily basis. So I do a lot of that type of surgery.
How did you decide that that was something that really interested you?
I just got a lot of training and a lot of in residency because gastric bypass surgery was kind of up and coming when I was in surgical training. And when you do the gastric bypass part of it and you lose 150 pounds, well, people don't really think about it, but you have a lot of hanging skin, and that needs to be dealt with as well.
Yeah, it's very difficult. How do you find clothing? You're a totally different size, but you have all this like hanging extra, skin and tissue. Yeah.
Right.
And if you see someone do the work for that, where they have really worked hard to kind of change their life and lose the weight.
It's the last step. It's the last step in a transformation of somebody. Right.
Yeah, which is really incredible to kind of help carry them across the finish line.
The finish line.
Yeah. Now, what else in terms of your practice? I mean, you do everything. Yes.
Like I said, I do the full range. I do facial surgery as well, body surgery, and then reconstructive surgery. I do probably at least half my practice is reconstructive surgery, which is great for when I go to the Naval Hospital. I do some interesting type surgeries there that I wouldn't do in my own practice, and it's a nice way to keep my skill set up. So I do hand surgery.
Tell us about that. Like, what do you mean?
Breast reconstruction.
Okay, breast reconstruction. So somebody that we were talking about previously, if they have to have a breast reconstruction, you go in. How does that work in terms of someone has a, say, cancer diagnosis, and then they have to have a double mastectomy or something like
Typically,
that?
it's all in one operation. So actually, I mean, sometimes it's staged, but the most common scenario is that you have your diagnosis. Within several weeks, you're in an operating room for either a lumpectomy, which is done by a breast general surgeon, or a total mastectomy, which is also by the same surgeon, but you wake up with some start of a reconstruction in the breast. Sometimes the entire reconstruction is done by the time you wake up, so the breast surgeon removes the breast and the plastic surgeon, all in the same operation, makes the new breast, either with an implant or with tissue from the abdomen. And then other times you do a staged approach, but commonly in this country, it's one operation. First part of the operation, breast surgery, removal, mastectomy, and then second part of the operation, under the same general anesthetic, is the reconstruction. Right?
And people must be really, that I think should, I don't know, in terms of the healing process, must be so helpful for women to be able to do something like that and feel like a woman again.
When they wake up from the surgery.
It used to not be the case. I mean, only until maybe 20 years ago, insurance companies weren't paying for breast reconstruction.
Can you believe that?
And actually, Senator D'Amato was the one who spearheaded that legislation.
Exactly.
It used to be that you only had the mastectomy, and then you're
on your own.
And if you could afford it, you went back to the operating room if you could afford it, and then paid for a reconstruction. So we've come a long way. And actually, when I go to on the weekends to Bethesda, there's plenty of elective surgery, including breast reconstruction, done as well. It's not just war wounds. We do a lot of that, but as well as breast reconstruction, skin cancer, and everything that a normal tertiary care medical center would do.
You work on both men and women at the Naval Center.
Yes.
Are you finding that facial wounds are predominant in choosing to undergo some kind of plastic reconstruction? Not cleaning out limbs, but what the shrapnel that.
Sure, that's an active part of what we do. I mean, there's a lot of blast injuries to the face. So you have shrapnel, you have facial fractures, you have eye trauma. There's a lot of head injuries, brain trauma. So there's a lot of that from a functional point of view. And then, of course, near the end of the staged approach, Then we start doing stuff to remove tattooing from shrapnel injuries, because you don't think about it, but this gives you horrible tattoos, usually dark green tattooing from these blast injuries, and you have to carve out these tattoos.
That's what I've heard.
I didn't know that.
Yes, that's what I've heard.
Do you graft after you carve it out, or you just?
It's hard to graft on the face because the graft itself is not a great aesthetic result.
Yeah.
So we do sometimes use lasers, dermabrasion, and sometimes if it's deep, if there's actually still shrapnel left in, and it's not too difficult to retrieve, we'll surgically remove it.
Take it out.
Yeah.
Interesting.
Yeah.
Have you ever had to have anything like, like sewn on? Have you ever had to have stitches?
I have.
I
actually, when I was 9, somebody threw a rock in my face, and I had about 7 or 8 stitches right here on the left side.
You can't see it.
I had a good plastic surgeon. So I can't even see it.
Do you remember who did it, or did you ever?
He got him back.
No, I'm just saying.
I
It's so
think you're
fascinating. You say,
asking,
look, I
right.
became a
I
plastic
do know.
surgeon too.
Yeah, I do know who it is, and I've talked to him. Yeah.
You're not going to say.
No, his name is Dr. Bernard. He's in Westchester.
Oh, okay, Dr. Bernard.
You meant who did the surgery? I thought you meant who threw the rock.
That too, we're going to get him.
Yeah, I remember his name too.
Well, but
bet
that's
you did.
amazing because
Now,
yeah.
I have one more question, which is kind of fascinating to me. Are you finding a difference between men and women as far as choosing to undergo any kind of facial reconstruction?
Well, facial reconstruction in a setting of trauma you don't have a choice almost. And these are horrible injuries, so it's not like a question of I think I want to get my nose put back on. I mean, it's horrible
I understand
injuries.
that.
So if you're talking about are you talking about a cosmetic type of
more cosmetic,
not from trauma?
Only because the idea of the stereotype of someone who goes into the military is a tough heave-ho kind of person.
Right.
He comes back, he looks different. I'm just setting up a scenario. Looks different. Now he has to have major reconstructive surgery on his body, and the face is a little bit off. Is there a difference between? Is there a reluctance of men?
There is, but actually, to tell you the truth, there's probably not much of a reluctance. There's plenty of men who are looking to, as best they can, regain their former face.
That's
and so
great.
they have a large scar on their face, and they're a young, healthy Marine. Otherwise, yes, they come in and they want something done, and they're entitled to it.
Yes,
yeah, good.
Absolutely,
they are.
good.
Absolutely. So we have a bunch of emails that if I may take a moment to read a few of them. Hi, Kimberly. Today is National Day of Prayer, so I first would like to thank Dr. Elan for his service, and also I pray for all men and women in uniform and their families for God's blessings upon them. That's very nice from Texas. And Bob says, kudos to Navy surgeon. Thank you for your service to our country, ! I'm a huge supporter of our military and the Israel Defense Forces. That's Bob from Arizona. So that's like a shout out for your mom too.
All right, she thanks you.
We like that. And let's see. Dr. Archer, what makes some people able to accept tragedies and work to continue while others cry, why me, and throw their hands up and wait for help? Just talking about Haiti or...
Right, well, I think we covered that.
Okay, so you're not going to...
Well, no, as we said, I think there are the two personality types of the victim versus the survivor psychologically. I think that some of the things that make a survivor would be something bigger than yourself. Some cause, perhaps kids, perhaps your work, something you feel that you need to keep going in order to do, in order to accomplish. And it's more important than you or your suffering or the trauma or the tragedy or anything that you've been through, because you have this reason that you have to overcome to keep going. So I would say that's the one thing more than anything else which can help determine that.
And kind of the center of mental health is your sense of resilience and your sense of being able to bounce back.
Yes.
So that would probably work with that also.
Agreed.
How do you find it working with children when you have to do procedures on them? And
I enjoy working with children. You know, like I said before, it's not easy working with a child who's suffering, but I actually enjoy it. They're very resilient. They heal fantastic because they're young and healthy, and so I enjoy every part of working with children. It's very actually easy to do.
Is it a little bit easier
Yeah,
sometimes
because
than the adults?
it's actually a lot easier. I mean, it's much more difficult than dealing with the parents than it is with the children.
I'll agree. Actually, that's why I don't do child psychiatry right there.
Yeah.
I love the kids. I couldn't stand working with the parents. So
I love working with
Well,
children.
I work with kids also, and I love working with kids. It's absolutely joyful,
Right.
and you do get a lot of progress.
And it makes you young.
in hand, and it keeps you young. And hand in hand, working with the parents, I find very challenging because a child doesn't exist in a vacuum.
right.
Right.
So.
Yeah, I remember when, recently I have a son, Ronan, who's 3 years old. Ronan the Destroyer. And he was playing
Take
with
off
this
from
airplane.
Conan,
Yeah,
Ronan.
and I was at work here, supposed to host on the weekend. Geraldo was out. And I get the call on the way to the emergency room. I can't understand. So we need like a UN interpreter. Like 22. She's speaking Portuguese. I'm like, what is that again? They were on her way, and he had fallen and had his Air Force One airplane thing metal, and went right.
Oh no.
Yeah. So, but I didn't understand the extent of the injury at the time. So I'm like, it sounds bad. He's gonna need stitches, bleeding, etc. So I then called my pediatrician, who gave me Dr. Jetter. Do you know Dr. Jetter? He's in your practice.
Yeah, he's the guy I share the space with.
Yeah. How funny is that?
Very funny.
That happened
That's
a week before I met you. So I'm in the cab, and I'm supposed to like go out in the air, and anyway, it's no problem. It was like an hour and a half. But anyway, so I'm in the car rushing there because I'm like, where are you taking him? He's like, okay. And he went to Lenox Hill. So
Right.
I'm calling. I'm like, oh, please. So I call his practice. She goes, he'll call you right back. He's a really good guy.
Yeah.
And he's good with kids and the whole thing. So I'm like, he calls me. I'm like, please, we haven't met before, but can you please meet me? I'm, at your hospital, and he has a facial injury.
That's funny.
Whatever. So yeah, he came over. He was so great. I felt very comfortable. And I also, knew that he had done this a lot and everything. And they said he's, with kids that come in. So he sewed him up. He said he had to do double stitches, I guess, the inside and out. But we were lucky because it didn't go here or through something else where, oh my gosh. But so now it's healing. We went back to his office. So I was just there Friday before I met you. And so when I saw your car, I was like, 737 Park. I was just out there.
That sounds familiar.
And I took all the lollipops. I'm not going to lie to you, because he has this big bowl. I was like, eating everything.
That's funny.
Yeah, it was so funny. And so he put in like the surgery strips after, because he took this, removed the stitches, which is not 4 of us holding him down.
Wow.
And he said to me, he said, Dr. Shetty, he's like, it's not nice. Let me up.
It's not nice.
He's like, it's not nice. He's like, Mom, help me. Because we had him in there, his mom,
Right.
Dr. Jetter's mother was
That's
in
right.
there.
Oh, God.
And the receptionist in the front, like, we're holding him down. Like,
It's an army of people
gosh,
holding him
here
down.
we
Yeah,
go.
kids don't really like that.
No, he doesn't like to be
Yeah.
on his back. Like they say, I'm not
Right.
having that. And
That's
he's
actually
very
the
strong.
biggest. It's usually not the procedure. It's being restrained is what bothers
That's- he
children.
doesn't
the
like
most.
that.
It's
It's also a rite of passage for
Right.
every young boy. Either you get hit
I
by
know.
a rock, or you break something with an airplane.
Right.
or
I had
you
my nose
fall.
broken. So,
Right.
Yeah.
It's the rite of,
It's a
it's
rite
a
of
rite
passage,
of passage.
especially for a young boy.
Yes.
Chin laceration, forehead laceration.
Same thing, right? So it's just there, but he looks really great, and he's in a photo shoot right now as we speak in Hampton's Magazine. I'm like, perfect plastic surgery right before the photo shoot. Amazing. He doesn't care. He loves it. He's like, loves to wear, like, he puts like a little SpongeBob bandage over it, because Dr. Shetty's like, keep it out of the sun, put scar guard on, do the, the whole deal.
yeah.
My nanny's saying,
That's his badge
300
of
prayers
honor.
a day.
That's his badge of
If something else
honor.
happens, I kill myself. I'm like, listen, I'm late for work. There's no killing yourself. We'll talk about it later.
Women like scars. You can tell him that when he's older.
Yeah, it actually looks really cute. So the teacher said all the girls are coming up to
Right.
him and they ask, the whole thing. So he'll survive. But that's how boys are. And I was like a nervous wreck after, because I was like, okay, let's just calm down. Let's not. So I had to leave and come back on. I was at the hospital at 9:30 at night, and then I was live at 10. So we just finished. I ran back, went on the air, did the show, get back to my house. And I'm thinking maybe he's going to be calm or like quiet or upset or something. No, he's jumping up and down, throwing all the pillows off my bed and jumping off of the thing.
Right.
And it's high, too.
Yeah.
I'm like, oh, yeah.
Life is good. It's all good.
Kids forget.
Mom,
They forget.
yeah,
Done.
no big deal.
Done. He was like he didn't care.
They forget, exactly.
He just wanted a little popsicle. He's like, can I have a popsicle?
That is the joy of working with kids.
Yeah. So
It is.
anyway, so far so good.
And having them.
Happy ending. I don't know. I never had any of that when I was little. Like the most I had was like I had to have plastic surgery on my leg for like a mole that was, they had to excise tissue. That was it. I'm boring. Well, thank you so much for being here with us today, Dr. Singer.
it was
we
great
had
to be
such a
here.
great time, and Dr. Archer and Dr.
Good to be here.
Pleasure, and very interesting the work that you do. We love hearing about it. Maybe you should have your colleague, your friend from medical school, come back sometime if he's in town to talk about the program.
He'd love to. I'm sure he would.
Yeah, I think that would be really great. And thank you to the viewers for being with us here today for this special hour. We'll ask that you stay tuned. Keep it right here on Fox. The Entertainment Hour with Jill Dobson is up next.